Hi, my name is Erin and I'm a DONA certified birth doula, and I've been working as a doula since 2022. I was born and raised here in the DC area and live in Northern Virginia now with my 2 kids. And I came to birth work through a public health background professionally. I have a master's degree with a focus in maternal and child health, and I've spent the last 15 years working at nonprofits and public health organizations focused on issues including chronic disease, HIV prevention, sexual health, and the use of public health data to inform programs. So over my career, I've done a lot of training and education for the public health workforce, but a few years ago, found myself really wanting to get back in touch with my roots of getting to be a big pregnancy and birth nerd, and to do that on a more individual level and in a hands-on way, working directly with families as compared to the more policy-focused work that I was doing in the other half of my professional life. I also had a doula at both of my births and found it so valuable to have the dedicated and experienced support in the room, especially as a first-time parent, but even the second time around, because labor can be unpredictable and no 2 births are the same. So after having kids of my own, I decided to go back and support people from the other side, so to speak, and become a doula myself. And so I've done a combination of solo practice work and some volunteer-based work in the area over the past few years, and I'm now really excited to be part of the DC Birth Doulas team. And for me, as someone who comes from a health education background, I really love being able to connect families with reliable and evidence-based information when preparing for labor and birth, because it can be really overwhelming sometimes to sort through all of that information on your own and to know which sources to trust. I also consider my sense of calm to be one of my main doula superpowers. I think one of the really unique roles of a doula is getting to focus on fostering that safe and supportive environment during labor, both in the physical sense and in the emotional sense, and to kind of help co-create that space with the person giving birth and the rest of their support people and their healthcare team. And so that's really my goal in working with families, is to make sure they have the right information and the right tools to best support the birth experience that they are looking for, so they can start out their parenthood journey from a place of confidence, support, and empowerment over their own birth story.